Welcome back to Foundations of Health, and today we are on session 4, which we're going to look closely at different diseases and how it relates to food, part 1. We have a lot to cover, so put your seatbelt on, and here we go. The disclaimer. Once again, information in this video has not been evaluated by the FDA or any other medical body. I do not diagnose or guarantee treatment, cure, or prevention of any illness or disease. Information is shared for educational purposes only. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Heart disease. We know there is a connection with the body's microbiome and heart disease because when arterial plaque is taken out, there's actually bacteria with it. A big factor of the inflammation in the heart that causes heart disease is the inflammation of the gut. I think of it as fire in the gut, fire in the heart, and also know fire in the brain, because what happens in the microbiome of a gut can drive the microbiome inflammation throughout the rest of the body. So these items were said by Dr. Mark Menelacino, and he's quite outspoken. What's interesting is there's been a misconception in the medical science world for years, decades, that our body was basically sterile. So now we're learning that there is bacteria everywhere, and these bacteria need to be the beneficial ones. And that comes down to what did we talk about before, to what we eat, what food choices we make, to how much stress we have, how much sleep we have, even exercise. We need to get moving. We also know that there's no one-size-fits-all diet. Now, like I said before, there are foundational steps you can take to really change your diet that across the board everybody can do and everybody will benefit from. But when you're whittling it down and you've got symptoms and you've got conditions and you've got dis-ease, at that point, each person is individualized. What genetics or what genes have been expressed in your body? So that's the root cause. We need to figure out if you do have a diagnosis or a condition or something like IBS, IBS-like symptoms. So those things, that's when you whittle down to an individualized recommendation. So from CDC, Center for Disease Control stats, published in 2015, about 610,000 of people, that did not come out right, about 610,000 people die of heart disease in the U.S. every year. That's 1 in every 4 deaths. So coronary heart disease is the common type, which kills over 370,000 annually. Risk factors for coronary heart disease are diabetes, being overweight, obese, poor diet, physical inactivity, and excessive alcohol use. Afrooz Demiri, who is a board-certified naturopathic MD and director of functional medicine at UC Irvine, says the biggest things I see are patients who are on cholesterol-lowering medication. If you actually look at the research, looking at a 10-year, 20-year, 30-year, 40-year decrease in having a stroke or a heart attack being on a statin, you're decreasing the risk maybe by 2.7%. But if you were to look at why is that patient's cholesterol high? Is it that it's recirculating and being reabsorbed in the gut and not going out? Or is it that the liver is making too much? And that's where a statin medication addresses. The implication that's being made is no one's looking at the root cause of these cardiovascular issues. And instead, they're just targeting, high cholesterol, we need to lower it. But why is the cholesterol high? What's going on? Is, like she said in the quote, is it just being recirculated because something's wrong with your detox pathways? Or is it just that your liver is overactive for some reason in generating cholesterol? So what's going on here? So heart disease prevention is so important because we know it's the #1 killer of Americans. Cardiologist Barbara Roberts reminds us that the #1 killer of women is atherosclerotic cardiovascular disease. That is a fact that was really not known to the vast majority of women until very recently. As a matter of fact, polls done as little as 10 years ago showed that most women thought that they were more likely to die of breast cancer than any other disease. And I think some of that still looms today. In fact, if you are a woman, you are more likely to die of heart disease than of the 10 most common cancers combined. All right, let me say that again. If you are a woman, you are more likely to die of heart disease than of the 10 most common cancers combined. One of the risk factors for this is diabetes, which I mentioned before. So much so that when you have diabetes, you are at equivalent risk of having a heart attack as someone who has already had a heart attack. So that's how much diabetes brings your risk up for heart attack. Dr. Roberts continues that diabetes in women is particularly deadly, and she emphatically makes this point in the interview that I listened to. And by the way, type 2 diabetes, it can be reversed in so many people. I mentioned Dr. William Davis, cardiologist. He treated a lot of diabetic patients because diabetes and heart disease go hand in hand. He reversed quite a bit with just dietary changes. So that's the great news. The bad news is no one knows about this. So not enough people know about this. So we've got to get the word out. One of my clients started her down this path, and she came to me because of Parkinson's disease. She also had diabetes, and of course she had high blood pressure. So she was on her way toward cardiovascular disease. About a month later, she went to go back to her doctor for a checkup after I had made some recommendations, and she made some pretty significant changes in her diet. And her doctor took her off all of her diabetes medications and all of her blood pressure medications. Just, you don't need them anymore. See what I'm saying? So it's not rocket science, but it just needs to be out there. People need to know how they can eat to not only prevent these diseases, but to potentially reverse these diseases. All right. So let's take a quick look at cholesterol. Is cholesterol being unfairly vilified? Cholesterol is essential to life. I'm not kidding. Integral to every cell membrane in your body. If you didn't have it, your cells would not be able to survive. 25% of the cholesterol in our bodies is in our brain so that our brain can function normally. It's the insulation cholesterol that allows nerves to conduct electrical impulses quickly. On a side note, I took some advanced courses in neurodegeneration, and one of the doctors had mentioned that they have done studies that show that people with cholesterol that's too low, they are at a much higher risk of neurodegeneration than not. So I thought that was interesting. Our body is so intricately complex and resilient. However, cholesterol is one of those where there's you can have too little and you can't have too much. So there's a medium. There's a balance in there for your body that's going to allow you to function properly, even brain function. I know when I used to think about cholesterol, it did not equate to, are you mentally sharp? Are you focused? Well, now it does. I think about cholesterol and yay, we need well-formed, healthy cholesterol. You can have unhealthy cholesterol. And I'm not talking just LDL across the board, because we absolutely need LDL, but it needs to be in a fluffy form. What happens when we eat a lot of processed food? The LDL is malformed and it's not fluffy and it doesn't function like it should. That's when your LDL is bad. But calling LDL across the board bad cholesterol, it's not. It just needs to be well formed. And there's so much more. We just talked about studies on cholesterol. Speaking of cholesterol, let's just jump over to fat. Fat, also unfairly vilified. You need fat. Your brain is primarily made of fat. You need good fat. You don't need hydrogenated, partially hydrogenated, chemically changed, and frankenfooded to death, inflammatory causing fat. You need healthy fat. All right, let's look at diabetes type 2. Ooh, I need to speed things up. We'll be here all day. All right, the CDC reported on July 18, 2017, that more than 100 million U.S. adults have diabetes or prediabetes. People with diabetes are at increased risk of serious health complications, including premature death, vision loss, heart disease, stroke, kidney failure, and amputation of toes, feet, or legs. Do you remember what Dr. Roberts said about type 2 diabetes in women? It is particularly deadly. Avoid it at all costs. Stop eating sugar. Stop eating simple carbs. Stop eating wheat. Stop eating processed foods. By addressing diabetes, we limit other health problems such as heart disease, stroke, nerve and kidney diseases, and vision loss. And come on, one fell swoop. Diabetes is an epidemic, and it can be stopped with just making wiser food choices if people understood what food choices to make. And that's why I'm here. Autoimmune disease. So this is my personal story here. Autoimmune disease. Let's dive in. Autoimmune diseases are on the rise. Many go undiagnosed, however. Autoimmunity is a condition where your immune system attacks your own tissue. According to the American Autoimmune Disease Related Association, the current stats in the U.S. are 1 out of 12 women have an autoimmune disease, 1 out of 20 men have an autoimmune disease, and most get undiagnosed forever. Most people don't even realize that what they have is an autoimmune disease. Let's give you an example. Fibromyalgia. That's an autoimmune disease. You can treat the symptoms of pain all day long. It's not going to get better. You've got to get to the root. So let me just run off a list of autoimmune diseases. Type 1 diabetes, Hashimoto's thyroiditis, which starts out as hypothyroidism, rheumatoid arthritis, lupus, eczema, autoimmune encephalitis, autoimmune pancreatitis, celiac disease, Crohn's disease, endometriosis, fibromyalgia, Graves' disease, inflammatory bowel disease, myasthenia gravis, myocarditis, heart, multiple sclerosis, psoriasis, ulcerative colitis, vasculitis. There's over 100 different autoimmune diseases, and we are seeing in clinics that in many cases, the progression can be halted and even reversed, which is exactly what happens to me because I will always have Hashimoto's thyroiditis, but it can be in remission. And it can be in remission because of the foods that I eat and the foods I don't eat. And so that's great news because the hospital's not fun at all. I don't recommend it. When you have autoimmune disease, we know from a functional standpoint, because we go back to root causes, we know that 3 things need to be in place. There needs to be a genetic predisposition. There needs to be abnormal intestinal permeability. And there needs to be dysbiosis of your gut microbiome. So you can't control your genetic predisposition, but you can control the other 2. So you never have to get to the point where that genetic sequence needs to be expressed at all. I will say this. Read a study on PubMed about type 1 diabetes, and this is particularly harmful for children. If you know anybody, I know a bunch of people who are affected with type 1 diabetes. When mom or dad has type 1 diabetes and they are wanting to have children, there are things they can do to mitigate the expression of those genes in that new baby when mom gets pregnant. So if that's the case, please reach out to me because these are huge findings in research and very exciting. Many If not all autoimmune diseases are triggered by food sensitivity. So that goes back to our intestinal permeability. When it's permeable, the food gets in the lymphatic system, in the bloodstream, triggers an immune system response, and your immune system just goes crazy. And they're ramped up. They're like a military force marching out into the field looking for an enemy. And when certain food proteins look like certain tissue proteins, they will not only attack the food, they'll start to attack the tissue. And this was my case. Certain wheat proteins look a lot like thyroid proteins. So wheat sensitivity triggered my Hashimoto's, thyroiditis. Anyway, that's why it's so important to understand what foods work for you. I will have a course on that coming up here, hopefully this next year. So I'm excited about that. Got to help some people. Robert Roundtree, MD, family medicine physician, tells of one of his many patients with rheumatoid arthritis, which is an autoimmune condition. So this particular patient's doctor, not him, obviously, wanted to put him on strong immunosuppressive drugs, which is traditionally the way, it has been the way that autoimmune diseases have been treated. So this patient sought a second opinion as he was already on steroids and other anti-inflammatory medications. Dr. Roundtree treated him naturally with food, in other words, dietary choices, and supplements that will really regulate your immune system and bring him back to sufficient nutrition. The patient was eventually able to come off of the steroids, the anti-inflammatory medications, and actually felt really good. Got his life back. So that's what I'm talking about. This could have been my story. I sought out another doctor because I was like, medications is only treating the symptom, and how do you know it's really wrong? I was very frustrated till I found someone who wanted to find the root cause with me. So let's talk neurodegeneration. This is very scary. I know both sides of my family. My grandfather on one side and my grandmother on the other side progressed into dementia, and both of them eventually were diagnosed with Alzheimer's, and it's heartbreaking. So in 2004, this particular doctor, Datis Karazian, says that they did a study in 2014 where we took 400 healthy blood donors and we checked their blood to see what type of antibodies they produced. In people who had reactions against milk and wheat proteins, we found that 50% of them had antibodies to their brain tissue. Okay, this goes back to, remember how I explained there's a protein in wheat that looks very much like thyroid tissue. So my body went from attacking that wheat protein to attacking my thyroid, and eventually I developed an autoimmune condition. This is what Dr. Karazian is alluding to right here. So in people who were sensitive, who had immune system responses to milk and wheat proteins, half of them had antibodies to their brain tissue, which means their immune system had already launched attacks on their brain. They had created antibodies against their brain. This is some serious stuff. Parkinson's disease. Parkinson's is also a neurodegenerative condition, which is a different portion of your brain than Alzheimer's. Around 80% of people with Parkinson's had as their first symptom constipation. Okay. If you have constipation, it does not mean you are developing Parkinson's. The point of this is that 80% of those who later develop Parkinson's actually started with an early symptom of constipation. And because we've detached all of our body systems and given them to different medical specialties, we're missing these connections. We're missing these so vital connections. So constipation means there's something wrong. There's something going on with your diet. You're reabsorbing toxins because your poop is sitting in your colon for longer than it should, and all that stuff gets reabsorbed, and it's meant to be waste. So constipation, as a general rule, is not healthy, and that needs to be addressed. The neurodegeneration begins Any neurodegeneration, not just Parkinson's, begins long before the symptoms of diagnosis manifest themselves. Dr. Heather Zwicky, she has a PhD in immunology and microbiology, so her resume is actually a mile long. She was selected to be a member of an investigational board for an NBA player on the West Coast to investigate why diet had actually reversed his Parkinson's disease. So, this is a lot going on here. She's an NBA player who was diagnosed with Parkinson's, obviously very young. It's pretty stunning, the neurodegeneration in younger people now. Anyway, he radically changed his diet and his Parkinson's symptoms went away. He wanted to know why. So they put together a board, and Dr. Zwicky was on that board to figure it out. And she came up with some general guidelines for anyone who wants to prevent Parkinson's or treat Parkinson's. First one, do not eat dairy, period. Because it's one of our most polluted foods. Pesticides, herbicides, and cow feeds it's not a good risk. Dairy is also known to break down uric acid, which is a protective substance for Parkinson's. So it removes that protective substances. Avoid artificial sweeteners. And I would say that for anybody with a brain at all. I don't care if you're at risk for Parkinson's or not, at risk for dementia, Alzheimer's, any of that, or not, have a brain fog. Avoid artificial sweeteners because they are a known neurotoxin for everyone. They increase neuroinflammation at best. Avoid trans fat due to its inflammatory nature. And I would say that for everyone too. Avoid high fructose corn syrup. High fructose corn syrup spikes your blood sugar unbelievably high. When your blood sugar spikes, it chemically alters your brain. People with diabetes, because of the uncontrolled blood sugar, are at a 400-fold risk for Alzheimer's. 400-fold. Don't eat high fructose corn syrup. Drink green tea, which we know as matcha tea. This can delay the onset of Parkinson's for nearly 7 years. This is interesting. I did not read the full study, but it'd be interesting how they figured that out. Now, you can go get a can of green tea and it's all liquid. That is not the same. You're not going to get the benefit. Look up here. You see this powder? You want some green matcha tea powder. It doesn't dissolve. It's an acquired taste. It's earthy. It's a plant, but has some amazing nutrients in it. So I have 2 cups of matcha tea every morning. Depression. So Dr. Hyman says depression isn't the cause of the symptoms. It's the name of the symptoms. The causes could be many. It could be that you've taken antibiotics and altered your gut flora, and you have dysbiosis that's leading to inflammation of the brain. It could be you've got a low thyroid, or you're eating gluten that's triggering neuroinflammation. It could be that you have taken acid blockers for years and don't absorb B12 because of it and have a B12 deficiency. Or you have a vitamin D deficiency, or maybe it's because you eat a lot of sushi and have mercury poisoning. Or maybe because you hate fish and have omega-3 deficiency. Or you eat a lot of sugar and have prediabetes, all of which cause depression. You have the ability to take control of your health in so many ways. This is why I'm giving you this information. There's a relationship between lack of serotonin, which is the happy hormone, and moodiness or sadness or depression. Most of our serotonin is produced by cells in your gut, as in close to 90%. But those cells can't produce serotonin in adequate amounts unless there are certain microorganisms, the good ones, present who generate the molecular byproducts that our cells need to construct the serotonin. So tying it all back to that microbiome, all those roommates that outnumber us 10-1, they're important. In January 2017, a study was published in BMC Medicine Journal showing that people with moderate to severe depression improved by eating a healthier diet. In fact, 32% of the clinical trial patients no longer met the clinical criteria for depression. A French study published in 2018 demonstrated a link between systemic inflammation, dysbiosis of the gut, and patients suffering from depression. You control what you put in your mouth. So these are some really exciting studies, I would say. Autism and ADHD. In wrong slide. In an interview in 2018, Dr. Zach Bush, who is a triple board certified MD in internal medicine, endocrinology and metabolism, and palliative care. All right, so in an interview, he's talking about autism and ADHD, and he says, when I grew up, I never heard of autism. And there were certainly no kids in my school that had autism, and I was just a normal kid like everybody else. Now you go to school, and we're at 1 in 36 children with autism. But let's back up. What was that number in 1975? 1 in 5,000. So let's look at this stat again. Now, and he's talking in 2018, 1 in 36. This is enormous. This is enormous. And it's such a huge drop. I used to think, well, it's because we're diagnosing, our diagnostic tools are better. And the more I read about this, I don't think that's the case. 1 in 8 has AD or ADHD. At the current rate, will be at 1 in 3 children with autism by 2035. That's not that far, a little over 15 years from this point. So in a kindergarten class, he talks about in this interview. So in a single kindergarten class, you see this huge neurological stress, for example. So he says, our trajectory from 1 in 5,000 children in 1975 to 1 in 36 today, 2018, accelerated the fastest since 2012. So we were on a pretty steep climb. So he's looking at the data. So we were on a pretty steep climb. And then he said, in the past 6 years, since 2012, he said that the stats just went vertical. It's crazy. So he continues. There's an imbalance in neurotransmitters in the brain. That's the fundamental pathogenic mechanism of some of these conditions. But the cause of those, we need to zoom way out, and it tends to be micronutrient deficiencies, microbiome disruption, food reactions, and so forth. So we can do some pretty fundamental treatments to turn this around, because he treats a lot of these kids. He goes on to say, we have, speaking of his clinic, a great track record with treating autism, and his clinic takes it from a functional approach and starts in the gut, starts with digestion, just like all of us trained functionally do. In this population, we see a disturbance in the microbiome. We often see food addiction, food allergy, food sensitivity, micronutrient deficiencies. There is evidence now that the microbiome is highly modified in kids with autism compared with kids who are not autistic. So imagine the possibilities if we health coaches could form therapeutic partnerships with these psychiatrists, psychologists, neurologists, and really help families sort of put their lives back together. Because when a child has some brain challenge, whether it manifests itself in autism, in ADHD, something similar, it really impacts the entire family. So what an impact dietary choices and supplements can really make a difference in families. In 2004, a published report evaluating all of the current studies, so they'll go through and look at all the current studies relating to autism and ADHD. They came to the conclusion that removing gluten and dairy were of significant benefit to autistic children because of the significant reduction in autistic traits. And they're still trying to figure out, according to the study, back in 2004, that mechanism. The movie I mentioned in one of the previous sections, Secret Ingredients, deals specifically with this. So it's very interesting. If you or anyone you know is dealing with autism in any way, shape, or form. Skin conditions. So eczema, rashes, some rashes, acne, rosacea, etc. are usually triggered by gut dysbiosis, and eczema, now we know, has been found to be an autoimmune disease. Sugar and dairy are two of the biggest culprits in these skin conditions, and gluten closely behind, contributing to all of this, especially in teenagers. When their gut's messed up, they eat a lot of carbs, eat a lot of sugar, eat a whole lot of gluten. So you're talking like pizza, fast food, all that stuff makes the acne pretty bad. So Dr. Raphael Kelman, he's an MD internal medicine, states, for all of you out there who've been suffering from fatigue, depression, brain fog, different types of pains and aches that are constantly changing, and there's no diagnosis for you, well, it's because they've used their own model. So talking about the conventional medical model. But if you understand it as processes and how the microbiome plays such a critical role, because that's not functioning as well, now there's your solution. There's answers for all of you. And it's because we're going to use the microbiome and understand it as scaffolding that affect and hold up the whole body. That's a huge statement right there. It heals the brain, it heals other organs, it heals the immune system in one broad stroke, and there's no drug that could possibly do this. That's pretty exciting because you can really take charge of your health. Yay! So food really is medicine, and personally, I'm living proof of that, and these doctors have alluded to that through their clinical experience, and I see that in my clients as well. So we know the gut microbiome plays an extraordinary role in maintaining good health and preventing disease. We know that each person has been uniquely created and responds differently to our changing food supply, Frankenfood. We know there is no one-size-fits-all magic pill that cures all ailments, and it's not going to happen overnight either. So that applies to any dietary changes too. It's not instant. There's good evidence pointing to the gut microbiome as the starting point for healing all non-infectious diseases. Whew. In our next session, we're going to dive into cancer and a few more things, and then we will wrap this up. So I'm super thrilled you are here, and if you have something complex going on, I offer free 15-minute discovery sessions. So hop on over to my website and you can schedule one of those. I'll be happy to talk to you. Thanks for joining me.